2026 Medicare Part D drug plan cost structures. What has changed? Hello, I am Kevin Canals, an independent health insurance agent in California, and Medicare has released the cost structure for the standalone Part D drug plans for 2026, and not a lot has changed, and that's nice compared to a lot of the changes we saw in 2025. You will notice that on the standard cost structure, the deductible is now at $615. That's gone up. And the maximum out of pocket is now at $2,100. So in the standard benefit cost structure, all drugs are subject to the drug deductible of $615, excluding like insulin, because that's capped at $35 per month. So whether you are picking up your drugs at a retail pharmacy or having them mailed to you, you are going to be paying the full price for those drugs, negotiated retail price up to $615. Once your total drug costs for all the different drugs equals $615, then you drop down into the initial coverage phase and the drugs cost 25%. Then when that deductible and the 25% initial coverage phase equals $2,100, you are done for the year. So what does that look like on a monthly level? So this graph shows someone who has drug costs of approximately $100 per month, okay? So in January, they spend $100. And so they spend $100 every month until June. And then, June, they start picking up those prescriptions and they meet the Part D deductible, $615. And that's when they go into the 25% coinsurance. So you can see how the line kind of flattens out because now the individual is paying 25% of the drug costs. Now, for this particular individual, for the whole year, they're going to be paying a little over $800 for prescription medications on the plan with the standard cost structure. They will not meet their maximum out of pocket. But what does it look like if someone does have very expensive drugs? So here is an example where the monthly drug cost, those retail costs for all the different medications, is $800 per month. Now, in January, we have $800. That individual is going to hit the deductible in January, the first month. Boom, they're going to meet it. So $800 minus the $615 deductible leaves us with $185. But there, $615 is going to be added. Then we take the $185 times 25%, because now, even in January, they're into the initial coverage phase of 25%. That leaves us $46.25 for a January drug cost total of $661.25. They've met the deductible, they're into the 25% phase, and now February through August, they're paying approximately $200 per month. Some of these drugs will have a copay, and it may not be exactly 25%, but it will all be approximately in that range. For September, they have met the maximum out-of-pocket of $2,100, and September drug costs are $38.75. And then there are no drug costs for this individual October through December. So let's look at the graph for that. You can see in January, $661.25. That's January's a big one. Then the green line, their monthly drug costs drop down to $200. In September, $38.75, and then $0 for the remainder of the year. As you can see, the red line is the accumulation of their overall drug costs until they reach that $2,100 maximum out-of-pocket amount, the MOOP as we call it, and they're done. Now that is based on the Medicare standard cost structure. Medicare allows the plan sponsors to develop alternate plan structures, but they have to be equal to what the Medicare standard structure is. So one structure that you may see as you're comparing the different plans and amongst everyone being offered in your area is that the $615 deductible will only apply to drugs in tiers 3, 4, and 5. Your name brand drugs, the expensive stuff. Generics, drug tiers 1 and 2, may not be subject to a drug deductible at all. You go straight into the co-payments and you don't have to move through any deductible. So what happens there is you may be paying, $5 or $10 for the generics, but you have to pay the full cost for the brand name drugs, and then you meet the deductible for the brand name drugs, and all of your drug costs, all continue to accumulate towards meeting that $2,100 maximum out of pocket. It's kind of confusing because people, they may have, very low generic and they're paying a, really expensive, one-off brand name drug that does meet the deductible. But, sometimes some people never, ever meet the deductible because the generics aren't subject to it. An alternate cost structure is where there is no drug deductible at all. You go straight into co-payments or co-insurance. And that can be very nice for some people. You will need to look at the plan premiums for those no deductible plans to make sure that it makes financial sense to be in that versus one of the other ones. And that's a great thing, a great tool at Medicare.gov. You can kind of look at the overall total monthly costs and annual costs. But on the alternate structure, no drug deductible, you just go straight into those co-pays until you hit $2,100 maximum out of pocket and you are done. The drug payment plan will continue for 2026, and that allows people to spread their drug costs out throughout the year. So for those people who have a drug plan where there's that drug deductible early in the year, they can get into the drug payment plan, and that will then reduce their monthly payments. Even though they are buying drugs throughout the year, you can see in this one, this is from 2000, the monthly payment plan starts at $34, then it goes up to $61, and then $82, and it goes up, but not as bad as having to pay for all of those drugs in the first couple months, and that can be really difficult. And then that individual meets the maximum out of pocket in September, so they have no more drug costs, but they are paying, in this particular situation, $245 per month for the remainder of the year, because that's the way it's like a payment plan, and they will have paid for all the drugs by December. You need to look at that because if you're with primarily generic drugs, it may not make sense to do the payment plan. You can start the payment plan at any time, but if you do it later in the year, the effects are kind of muted because you have fewer months to pay off the balance. You can opt out at any time, but once you opt out, then you have to, become current with the balance of the drugs. And that is administered by the Part D plan sponsors. So if you want to enroll in that, you call whoever you have enrolled into for your Part D drug plan. For folks that are low income, there is a low income subsidy, and that goes through Social Security. So to apply for the low income subsidy for the Part D drug plan, you go to Social Security and look for Apply for Medicare Part D Extra Help. It's Medicare that kind of sets those numbers, and you can kind of find that on their website. This is for 2025, where up to 150% of the federal poverty level, a single individual, $23,475, or a married couple, $31,725. But that's going to go up, but I would still say apply anyhow, because the way they look at income, you may be in the zone. Even if you think you're a couple dollars or a couple $1,000s over, you still may be in the zone. So I would apply. And there are a couple different levels depending on the income. If you're accepted into the low income subsidy program, there will be no deductible for the drug plan, even if your drug plan has it. If you're in category 1, your generic drug copays are $5.10. Brand name drug copays $12.65. If your income's a little bit lower, you may be in category 2, where the generic drugs are $1.60, $4.90 on the brand name drugs. And if you're in category 3, very low income, they're going to be covering all of those drug costs. So not a lot has changed for 2026. The Part D drug plans are just confusing by themselves. So the fewer changes we have, the better. The drug deductible is going up if your drug plan has one at all, and the maximum out of pocket will go up. You should have received an annual notice of change from your Part D drug plan telling you how that is all affecting you, and you want to check to make sure that the drugs that you're taking now are still on the drug formulary of the drug plan. Medicare.gov is a great resource for checking all of that out. Otherwise, if you have any questions, you may leave those down below. I cannot answer plan-specific questions about any of the carriers. So for InsureMeKevin.com, I am Kevin Knaus.